when you drink a glass of wine or beetroot juice, if you pour it out, it will be totally red, you know? So you put some water, you rinse it, and it still will be a little bit red, but less, no? You rinse it again. So it works simplistically in that way. Hi, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center, which is this clinic. Because kidney disease, kidneys are very important and have many functions to control many processes inside our body. So when the kidney disease happens or the kidney is going to failure, all those processes are affected. For example, patients become anemic, so you need to give medications for the anemia, iron or injections like erythropoietin. The patient may become malnourished with some vitamin deficiencies, you need to do those replacements. The patient might develop high blood pressure, you need to give blood pressure tablets. The patient might have some vomiting, you give medications for vomiting. So you treat all those complications. Many patients with kidney disease have associated diseases like diabetes, so you also need to give them medications for diabetes. They have probably high levels of phosphate in the blood or potassium. You need to give medications to control the phosphate, control the potassium, adjustments on the diet, sometimes some nutritional supplements, and whatever little other complication the patient might have. Some of them have heart disease, so you need to ask also some medications to protect the heart, like aspirin or cholesterol tablets. So that's why it's very important, because of the associating diseases around kidney disease, and because kidney disease affect many functions of the body. So you need to also support all those functions. Is the last stage that is called stage 5, when the kidneys cannot perform satisfactorily all their functions, probably around 5 to 10% of kidney function left. The patient by that time starts feeling quite sick, can become very swollen with fluid retention, probably in the lungs. Doctors might be worried that an acute episode of heart failure or respiratory failure can occur, so the doctors might recommend to go for dialysis. The potassium can become very high or the blood very acidic, and the doctors are worried about the heart going to a standstill or any funny rhythm of the heart, so dialysis needs to be started. When the patient has got severe anemia, or the patient simply is not thriving, not eating quite well, losing flesh, or getting malnourished, you also need to start dialysis. Or simply the patient cannot perform well in their normal life, cannot concentrate, cannot sleep, maybe a professional or a student, and it's really her lifestyle is affected, so probably you need to start dialysis. Either when it's very severe in the numbers we measure in the laboratory, or when the patient really is quite ill, that you need to start. But we need to strike a balance. We do not need to wait until the patient is totally ill to start dialysis. We just do it before that, before the patient starts really struggling and suffering. But we know that already is the time to start dialysis. Yeah. There are two main types of dialysis. One is hemodialysis, and the other is peritoneal dialysis. Hemodialysis works by cleaning the blood, taking your blood from your body, from your blood vessels, to the outside wall in a machine that has got a filter. The filter cleans the blood of toxins, and your blood is returned to your body cleaned. That process lasts around 4 hours, is done 3 times a week in special dialysis centers done by nurses there. That's one way to clean the blood. Many patients that would prefer to have it done by a special nurse, or do it in the center, they will go into that therapy. There are other modality that it is peritoneal dialysis. Simplistically, it's like rinsing your body, like you can imagine when you drink a glass of wine or beetroot juice, if you pour it out, it will be totally red, you know. So you put some water, you rinse it, and it still will be a little bit red, but less, no? You rinse it again. So it works simplistically in that way. It consists on putting a tube in your tummy, then you just pour some special water into the tummy. The water sort of cleanses your body for a few hours, then you drain it out. There are two submodalities I need to tell you are important. One is you can do that manually throughout the day. For many people it can be cumbersome. Other modality is that you use a machine that do it automatically when you are sleeping. So you connect to the machine when you are sleeping, the machine pours the water in and out several times throughout the night, and then when you wake up, you have already your dialysis. That is very useful for people who go to school or work 9 to 5, let's say like a taxi driver, etc. So it's more permissive. There is no, some people claim that one is better than the other, has to be personalized, but I can tell you simply that both clean equally good the blood in the long run, and the decision between both is mainly a lifestyle preference, provided there is no medical contraindications to any of them. So more, what is the therapy that permits more your lifestyle? Okay, the patient needs kidney transplant when the kidneys have failed. There is the option for dialysis as well, but in the average patient, the kidney transplant is the best option because it's the option that provides more chances for rehabilitation into your usual life. Also provides more chances for longer and happier and better life. So more quality and quantity of life compared to dialysis. Many people think they are equally good, but no, transplant is actually much better. So when you need a transplant, when your kidney has failed, and if you have the opportunity to go for a transplant instead of dialysis, you should go for it. To answer that, I need to define that there are two types of donors. The deceased donors is someone has died and has donated his or her organs for transplantation. But there is the other type of donors, that is a living donor, someone like us, that probably want to donate a kidney for the loved one, either daughter, husband, etc. No? So how you find that that's a suitable donor? So first, you need to find that indeed is a willing donor, you know, wants to actually give the kidney to the loved one, friend, etc. Then you need to do a medical examination with some tests to be sure it's healthy enough to live a healthy life, or high chances to live a healthy life for the rest of his or her life without one kidney. Most people can, but still there are some risks. So we need to be sure that that happens, because if we find a disease that probably can later make that person develop kidney failure or other organ problems, we probably should not, invite the people for transplantation. No? The other aspect is we need to see how compatible the donor is with the recipient. No? So we need to see if it's suitable regarding genetic or immune compatibility, meaning that once you transplant the organ into the recipient is not going to reject the transplant. No? So in a way, they are immune compatible. So we also do tests for that. But the most important is that they are willing, that they are medically fit, and there is no any major incompatibility that makes the risk for transplant rejection very high. Although we have medications that can be used for minimizing the risk, it's always better to do our best to select a donor that the risk for rejection is not that high. Okay, kidney transplantation is a major surgery. Like any other surgery, you can have risk like anesthetic, anesthesia, reaction to anesthesia, risk while opening, damaging another organ, bleeding, infections. but also the kidney transplant can be lost through rejection, through the time, or can be lost even immediately if there is a complication that maybe blocks the blood flow to the kidneys. So all those things can happen. But also kidney transplant patients need to take medications for the life of their transplant that can have many side effects. They are very important, but they can have many side effects. For example, increasing the risk for diabetes, for high blood pressure, etc., or other funny symptoms. Or these medications can increase also the risk of infections because they work by dampening the immune system. The immune system is the one that is going to cause the rejection, but also is protecting you against infections. So these patients can have more risk for infections. The infection can be mild, more frequent, or can be even life-threatening. And sometimes these medications need to be reduced to prevent that, with the potential to trigger a rejection. Also, these medications, by dampening the immune system, can also increase the chances for cancers. It has happened. And it's another potential complication because the immune system is also important to protect you against cancers. They need to take good care of that kidney transplant, take the medications more or less religiously, so to prevent rejection, not to allow rejection to happen. They need to monitor all those levels, follow the medical appointments, etc. But once they take care of the kidney transplant, the purpose of kidney transplantation is rehabilitation to your usual lifestyle, to continue enjoying life, etc. I've seen many cases of patients that just start secluding, living in a room because they have kidney transplant, not socializing with other people, not even their loved ones, quitting the sports that that they love, etc. Things can be done, but you just need to take extra precautions than when you were not ill. But still, you need to try to live a life as normal as possible.